Hello everyone, welcome to my channel. Let's talk about cancer. This is Thyroid Cancer Awareness Month and let's talk about thyroid cancer. So I'm a surgical oncologist and we deal with cancers of the thyroid gland. So when we talk about what are the different surgeries that we do for thyroid, so we can remove half a lobe of thyroid, that is called lobectomy or hemithyroidectomy, or we can remove the whole thyroid gland, which is called as total thyroidectomy or removal of the whole gland. Very rarely do we do any surgery less than this. These are the two main surgeries. Sometimes we remove only the center part of the gland called as Isthmusectomy. Now whenever we are talking about a thyroid cancer, the minimum surgery that is required is usually removal of the whole thyroid gland. Occasionally or very rarely is it adequate that only one half of the thyroid is removed and that is enough. Usually we need to remove the whole gland. Sometimes the thyroid tumor spreads beyond the gland into the lymph nodes in the gland neck. These are small glands which are there in the both sides of the neck, and the thyroid cancer can spread to either side or to the area below the thyroid. If it is involved, we need to clear these lymph nodes too as part of the treatment. Now whenever we do a surgery to remove all this, it may not be enough that surgery alone is the treatment. At the end of surgery, a month later, after preparing the patient, we may have to do a radioiodine therapy as well. These are usually the treatments done for the most common types of thyroid cancer called as follicular and papillary. In the other variety called medullary also, this is the kind of treatment that we do. There is another variety called as anaplastic carcinoma, in which usually surgery is difficult and not very useful. This is treated differently with a chemoradiation. It is a very rare tumor and a very aggressive tumor. Apart from that, the other three forms, which are the common forms, do exceedingly well with the combination of surgery and radioiodine therapy. So the main worries when somebody undergoes a surgery for thyroid cancer are only two. The glands which regulate a calcium in our body, called as parathyroids, are sticking to the thyroid gland behind it. So when we do the surgery, we have to safely look for it and separate it and preserve it and not damage it. Otherwise, post surgery, patients have low calcium in their blood, because of which they can have tingling sensation of the fingers, toes or in the mouth. So these glands are very small and difficult to see, but usually in experienced hands we are able to preserve it. This is one worry about this surgery. The other main cause for concern and complications which occur from a thyroid surgery are the injury to the nerve which supplies the voice box. So these nerves are again sticking to the thyroid on both sides and run behind it and enter into the voice box. So again, during surgery we always try to visualize and see this nerve, preserve it and then remove the thyroid. There are chances when it does get cut during surgery because its position is abnormal or the thyroid is too huge or it is not seen, in which case we always try to repair it during surgery. Success of that may be difficult to confirm at times, but if the nerve is cut, it can cause hoarseness of the voice or a change in voice, or sometimes it can become very soft. These are the two main complications which occur during thyroid surgery. It is important that all patients who undergo the surgery are aware that this can happen. It will always be the effort of the surgeon to preserve this nerve and make sure it doesn't get cut, but it is impossible for anybody to give a guarantee that it may not happen. So these are the things that one should be aware of when they are undergoing a thyroid surgery. This is the information about surgery. Good day.